love the small class sizes. I think the benefit itself is just having the one-on-one. Without the small class sizes, I don't think I would be as successful as I've been in nursing school.
This is the first time I've been in this small of a class since high school, and so it's pretty nice to actually know everybody and go through the same classes and struggles like that everybody else is going through.
I think they're great. They know if you don't show up. That's good. I think it helps a lot if you don't understand something. It's very obvious to the instructor, I think, just by looking around the room, because there aren't that many people in there, and so they're really quick to pick up on it and go back over it. I think that's a benefit you wouldn't get in a really large class.
I think the MediMan has given our students opportunities to practice some things that are much better practiced on a mannequin and a very realistic, lifelike mannequin than to be in the real situation.
The MediMan is a lot like a real patient, where you have to follow sort of a protocol and a list of tasks and then document them all.
It's a mannequin that can talk to you, and it has problems, and it's more of like a preparation for real life.
I was a little nervous. I heard about the workload and how it's a lot harder, and so I just had to adjust and, manage time.
I like the idea of having a closer relationship with your teacher, so having someone you can actually work with rather than being one of many, and not really having that close contact, especially if you have questions over the material in class.
They have packages where they've taken all the reference books and they've put them, they've computerized them so that they can be on the Palm Pilot. So they have 5 or 6 reference books right there that while they're in the clinical unit, if they're visiting with a patient in their home, all they have to do is pull this out and look up a med, for example, or if they have to do a treatment, they can go into their iPod. So it really brings the technology right into their hand, and it eliminates the need for them to have all these books with them.
I'm 25 years old and from Lawrence, Kansas. Went to KU, got a degree in finance, and then worked in management for a grocery store company for a couple years, and then decided to go back to nursing, partly because I've always wanted to work in healthcare, but I'm married and I have a 4-month-old baby, and my wife starts grad school in June, and so I need that flexibility, and I've always wanted the ability to move wherever I want and to have a flexible schedule that allows me to have both a family and a career.
Well, I was a legal secretary forever, and then my daughter became a nurse, and she likes it a lot, and I really liked what she was learning when she was going through the program. And in the back of my mind, I guess I was always interested in it, just never pursued it, and then I started my family, and I don't regret coming back being older. I worried about it at first, gosh, can I do that? It's been a long time since I studied, that kind of thing, but it really falls into place, and it comes back, it's I don't know, it's like riding a bike. You don't really ever forget how to study.
My colleagues are exceptional, but the students are what bring us back day after day. It's a real privilege, and that's what keeps me coming back every day. I really enjoy working with the students.
I've gotten to know a lot of really good friends, and I've become close to a lot of my fellow students, and so that was really cool. And with the professors, we're on a first-name basis, and so that just makes it more personal and makes it feel like they want you to learn instead of they're just there to teach.
I really like them. I was worried, being a non-trad, that it'd be hard to fit in, and that hasn't been the case. The kids are very warm, and I think they look at me as their mom or something, but yeah, they've been wonderful. I really enjoyed it, and the instructors have been great. They're very, very helpful. They're always there, and maybe it works better when you're older or something. I don't know. I think they feel like we have something in common, so I've enjoyed them.
I can tell you that every time we graduate a class And I know that these folks are going out into the world, and their influence will be far-reaching. That makes me very proud to know that I've been a part of helping to prepare them to do that.